So welcome back to another episode of Paramedic Zach. I know it's been a long time since I've gotten any episodes out, and I apologize for that. But I've been a bit preoccupied with another one of my hobbies, which is book binding and leather crafting. Which, if you're interested, my Etsy store will be back up and running in February. But besides that, we are back with another 10 flashcards. This is going to be questions 91 through 100, making us 1/5 of the way there. Let's begin. Question 91. Blank is the breakdown of skeletal muscle which releases toxic myoglobin into the blood. So any process that breaks down skeletal muscle will release a toxin into the blood known as myoglobin. This process is known as rhabdomyolysis. Question 92. Postpartum hemorrhage should be treated first with a blank and then PRN, or as needed, blank at a dose of blank to blank mLs per minute. So your first course of action in treating a bleed following childbirth is going to be a fundal massage. This can be performed with one closed fist directly over the pubic bone, massaging into the uterine wall. This should help reduce any postpartum bleeding. Secondarily, you can use a medication known as oxytocin, a hormone which is also produced in our body. Oxytocin will be given at a dose of 10 units in a 1000 ml bag of normal saline, and you're going to deliver the medication at a rate of 20 to 30 mLs per minute. Question 93. No axis deviation will present with lead 1 and AVF, both with positive QRS complexes. What will left axis, right axis, and extreme right axis deviation look like in terms of positive or negative QRS complex? Again, in leads 1 and AVF. So when determining axis deviation, you're going to look in leads 1 and AVF, specifically whether or not the QRS complex is positive or negative. In a normal axis of the heart, you have a positive deflection in lead 1 as well as in lead AVF. With left axis deviation of the heart, you're going to see a positive QRS complex in lead 1 and a negative QRS complex in lead AVF. With right axis deviation, you're going to see a negative deflected QRS complex in lead 1 and a positive deflected QRS complex in lead AVF. Lastly, with extreme right axis deviation, you're going to see a negatively deflected QRS complex in both leads 1 and AVF. I know that is a mouthful, but if you can remember this image, it's going to help you remember axis deviation. Moving on to question 94. Name the two hormones produced by the adrenal cortex. Hint: adrenal and cortex. The hint that I provided has the beginning letters of the hormones capitalized in the words adrenal cortex. For example, the adrenal cortex produces aldosterone. Aldosterone is responsible for the increase of reabsorption of sodium and the excretion of potassium. And in the word cortex, we have the letter COR capitalized, which stands for cortisol, which increases energy production and increases fat deposits. Moving on to question 95. Name 4 indications for nano-tracheal intubation. Hint: 4 things that would affect the mouth. So there are 4 reasons that you would perform a nasotracheal intubation over the preference of some other airway. These 4 things are trismus, intractable seizures, mandibular fractures or wiring, and oral pathologies. These things may inhibit a provider from performing a traditional endotracheal intubation or using a supraglottic airway. Moving on to question 96. So the answers for this question are going to be either the words inside or outside. Potassium is primarily found blank the cell, whereas sodium is found primarily blank the cell. So potassium is going to be found primarily inside the cell, while sodium is going to be found primarily outside the cell. Moving on to question 97. What is your pediatric bradycardia atropine dose in milligrams per kilogram? How many times can you repeat this dose? And what is your minimum and maximum doses? So you can treat pediatric bradycardia with atropine IV at a dose of 0.02 milligrams per kilogram, and you may repeat this up to one more time. Your minimum dose needs to be 0.1 milligrams, and your maximum dose needs to be 0.5 milligrams in a single dose. Moving on to question 98. What is your atropine dose for an adult in treating organophosphate poisoning? So the adult dose for organophosphate poisoning is going to be substantially higher than the dose you'd give an adult for bradycardia. This dose is going to be 2 milligrams IV. Question 99. If not done during resuscitation after ROSC, administer a loading dose of either A at a dose of blank milligrams or B at a dose of blank milligrams per kilogram. Then administer an infusion of the same drug. The infusion will be blank milligrams per minute for A or blank milligrams per minute for B. So when working a code, if you get ROSC and you haven't done it already, you're going to want to administer a loading dose of either amiodarone or lidocaine. I'm pretty sure in most places the drug of choice is going to be amiodarone, first given at a dose of 300 milligrams IV and then at an infusion rate of 1 milligram per minute for 6 hours post-ROSC. Secondarily, if you don't have amiodarone or your system prefers lidocaine, you can use lidocaine at a dose of 1.5 milligrams per kilogram as your loading dose, and then a continuous infusion at 1 to 4 milligrams per minute. To do this, you'll mix 100 milligrams in 100 mLs of normal saline. And finally, we have question 100. A newborn baby's respiration rate should be greater than blank, and a newborn's heart rate should be greater than blank. So for a newborn baby, you want a respiration rate greater than 30 and a heart rate greater than 100. Alright, so that is going to do it for this episode. I want to thank you guys again for joining me and apologize once again for taking so long to get this video out. But now that I have a little bit more free time, I plan on making many more rapid fire flashcard episodes as well as getting into some of the in-depth reviews as well. So I'll see you next time and take care.